ガス元気pour avoir.
1, 2, 3, 4. Oh. Hello, everybody. Can you hear me well enough up there? Thank you very much for your time. Thank you very much, dear organizers. It's a great event. It's my pleasure to be here. We came here to show you a innovative, I would say very innovative technology. 1, 2, can you hear me? Yes. Interactive holograms in augmented reality. So we are the Polish company from Poland, from Europe. The company name is MAGHREB. This beautiful picture is old town of Krakow, the second largest city in Poland. Whoever from you will plan to visit Poland, let me know. I will guide you with pleasure. Okay, we have a deal. Interactive holograms in augmented reality. Just one sentence to precise what is the difference between virtual reality and augmented reality, mixed reality. With virtual reality, we see only the reconstruction of some kind of reality with closed goggles or helmet. You need some kind of joysticks. But with I think this works better, yes? With augmented reality, we see both. You see surroundings, and you see the holographic reconstruction in this particular case, which is very important in this case because we talk about medical device for surgeons who are using this kind of technology on the surgery room and to prepare themselves to surgery as well. We support medical procedures and we do it during the surgery. There are three main use cases. The first one is to use this technology during the surgery. It's very important, very practical, and very beneficial for the doctors nowadays. The second one is the fact that you can use this technology for preparing yourself as a surgeon to the surgery. What they do now, they have, of course, reports from radiologists, they have the flat screen viewers to let them review some case of the patient, but with this kind of technology, they can interact with the holographic reconstruction of the respective body part. The third one will be, of course, to be used for and for teaching. If you would like, you can, of course, use it for junior doctors, so senior doctors would like to teach their assistants or students, for example. We recognize already a few specializations which use the benefits of this technology. So most often it will be cardiology, oncology, both adult oncology, but children oncology as well, which is very important for them as well. Then orthopedical procedures and a few more as well. It's very challenging for me to talk to you about something which you cannot see. The product itself is named CarnaLife Holo. So we have MAGHREB as a producer, CarnaLife Holo as a product, and we have our local distributor here in Algeria to help us promote this technology in your beautiful country. I will show you a short video which hopefully will let you understand what we are talking about. But the best way would be if you will give us 5, 10, 15 minutes. Please visit our booth. We have demo system and you can see it live. Whatever you see here, the best kind of marketing materials we would do, we are not able to give you the real experience. So please don't be shy, please visit us and try it live. What you see here, as I said, augmented reality. We see both. We see holographic reconstruction, in this case heart, and we see the surroundings. You can interact with the hologram in two ways, with gestures, like I do now, and with voice commands, like I do as well. So what is very important from the final environment point of view, as the surgeon, they touch nothing. They are fully sterilized because they touch air or they use the voice commands. They can make measurements, they can make different kind of reconstruction possibilities. Unfortunately, I have only 15 minutes window. I can talk to you about it half of the day. So if you are interested, please visit us. We can continue later. So there are rotation, they can zoom in, zoom out, and they can post-process it in different way how they like. Regarding the voice commands, here, for example, it was used real size command. Based on die context from CT scan, for example, you can create a size of the hologram one-to-one. You see here, for example, the blue virtual menu. So for the user, if they, for example, are not too familiar with some commands, they can always just use the left hand and see virtually again. They touch nothing, just air. So here is the patient, here is the hologram. With one command, for example, locate here, they will be seeing the holographic reconstruction always in front of their eyes. If they would like to put it on the patient, no problem. They look on the table, say locate here, and then the hologram will be on the patient, of course virtually. So this is the idea how you can make zoom in, zoom out with two hands to make it as big as you would like. By the way, in the surrounding you see our Krakow office, so please be very well welcome to visit us as well. I will show you now the real case, because what is very important for you to understand, we don't talk about startup, with all due respect to startups which we see here, great. We are far beyond. We talk about medical device, which is certified in European Union with CE mark class 2B, and the system medical device which is already installed in European countries. This case is from one of the most important German heart centers in Berlin. You see here one-to-one, this is the surgery of endocardial mitral valve repair. By the way, amazing surgery, amazing professor who made it. But what he has to do now, he has to find the optimized space between fourth and fifth rib and second place when they will make a small injection. So they are repairing hearts without opening chest. They are repairing, in this case, mitral valve with the small hole of the size 4 or 5 centimeters. And for him, it's very, very important to be as precise as possible. So this is what they use, and they said that it's very beneficial for them because they are 100% almost sure that they are where they should be. What else we have here? Okay, so real-time 3D hologram from PACS. I don't want to go too technical, but just for knowledge, talking about digitalization, which of course has to come. Congratulations for the nice lecture. As soon as the hospital is equipped with PACS, PACS is archiving heart of radiology diagnostic imaging devices. So then you can, of course, forward this kind of data to our workstation. As I mentioned already, completely sterilized system. And what is very important, the third point which you see here, we can influence on the length of the surgery. Why? Because surgeons are far better prepared, they are better known what they expect during surgery, and we have the works proven that we can influence on the shortage of the surgery even up to 30%. Better precision, better effective collaboration with patient, which is a new trend. I will show you one interesting picture in a second. Remote support, and as I mentioned, it is not a concept. Medical facilities, university hospitals, clinical hospitals are already using this technology. We have, of course, several prestigious reference sites. Some of you, like doctors, would like to talk to doctor, let us know. Of course, we can connect you with them. You see here number 500 medical treatments provided with this technology. The number grows week by week, of course. It's more and more. To summarize, main benefits, before surgery and during surgery, yes? So before surgery, we have access to accurate three-dimensional reconstruction. We have natural perception of anatomical structures, of course. We can help a patient to better understand the treatment in front of him, different kinds of measurements, visualizations possibilities, of course, and better, faster preparing for the surgery. Oops. I broke something, excuse me. Thank you. You don't help with my stress. Interoperative support. So during surgery, we can always, as a surgeon, see, verify our knowledge with the pre-surgery scan of the computer tomography, for example. We have full sterility, as I mentioned, And by the way, there is one option with specific echocardiography ultrasound devices when we can stream data live. 120 milliseconds delay precisely. From T-probe, we can stream live the data to the hologram. And reduce time, as spoke already. But I like this picture very much. This is one of the new trends. I don't know when it will come here, but to talk to patients. As more complicated surgery you have, as more advanced it will be. Let them know, show them. They don't know how they look inside. For us, from medical business, it's obvious, of course, yeah? But for them, no. They will be more calmer, they will have better attitude, and that influence on their positive rehabilitation after surgery as well. MAGHREB as a company, just a few words about us. We are not long, big players yet, but about 10 years history. As I mentioned, certified medical device. CE is done, FDA we're waiting, expecting Q2, Q3 this year. Then in every country, if local registration is needed, then of course we help to do it. We cooperate with different kinds of partners to promote, to introduce this technology. Some technological partners, medical partners, you know these trademarks, of course. Insurance partners. We develop the software, we develop the product. Of course, what you see now at our booth is version current, and we permanently work to develop. The new modules will come year by year, half year. Every half year we try to launch a new package of new features, and these respectful, prestigious reference sites help us to verify if our development is coming in the proper direction. Here's our current situation worldwide. We started, of course, from Central Europe because we are from Poland, Czech Republic, Slovakia, Hungary, Finland, Romania, Kazakhstan, Brazil, and now we are here. So we'd like to bring this technology to your country as well. So that's all from my end. So once again, congratulations from the great event, great place. Thank you for great weather. MAGHREB as the producer, and Reda as representative of COSYS, our distributor. In case you would need anything locally, please ask us. Thank you for your attention. Thank you for your time.
Merci, Monsieur Luczak. Merci beaucoup pour cette présentation.
Merci beaucoup. This is what I know in French.